Did you also get the school tax bill with an increase of 10 or 15%? Does your home insurance also increase by 10 or 15%? Recently, I got a letter from my health insurance, UnitedHealthcare, announcing a rate increase for my plan next year in the amount of 18%. We all know that the US healthcare system is the most expensive one in the world, but 18%? The inflation rate is only about 3%. What's going on? Hi, I'm Manfred Stapff, your host of the podcast, and I welcome you to the real-world evidence perspective, which gives you truth, data, and candid context. In this episode, we will look a little bit closer to the data and the evidence behind UnitedHealthcare's outrageous attempt to increase the insurance premium for above any inflation numbers or other growth rate in the healthcare system. Remember, in order to form an opinion, one often has to look behind the data, behind the sources in the overall context. And this may not always be easy and it may cost time, but let's try to do it for this one. Without providing any numbers or details, UnitedHealthcare tries to rationalize the increase by 18% with costs for medical services, Medicare deductibles, medical equipment and services, utilization services, and member demographics. You know, we're all getting older. One may understand that healthcare demand is increasing and the costs are going up too, but do these arguments specifically support the percentage amount by which UnitedHealthcare wants to increase these insurance premiums? For 2026, estimates by PricewaterhouseCoopers and by CMS suggest a rise in medical service costs by 11.8%. The standard Part B deductible for 2026 isn't specified yet, but it is unlikely to increase above the overall premium increase of 11.6%. The year-over-year growth in health services spending is projected to be around 6 to 8%. This is estimated by Health Affairs, a leading voice in health policy research. The Congressional Budget Office anticipate that the 65 and older demographic in the United States will grow at an average rate of about 1.1% per year. So all these numbers, which come from reasonable and credible sources, do not support the 18% claimed by the insurance company, specifically in the categories which have been used as justification. Let's look at some other sources which perhaps can help in understanding some economic developments and some growth rates. The estimated inflation rate for 2026 in the United States is generally projected to be around 2.8 to 3.2%. Some forecasts anticipate it to be closer to 2.3%, but we will see. The sources are Deloitte and the University of Michigan. Social Security's COLA, cost of living adjustment, is estimated to be 2.7%. There is something like an implied total premium, which is estimated by 3.4%. What does it mean? This is a combining medical services analysis plus insurance component, and it comes from the US Bureau of Labor Statistics, so also a relatively reliable source. So again, there's no way that these numbers justify a rate increase of 18%. Perhaps if we look at a few numbers coming directly from UnitedHealthcare, this will help us to understand. UnitedHealthcare's 2024 health insurance revenue increased from 2023 by 6% to $298 billion. They closed the year 2024 with a net income, which is the profit after all losses, even the special loss because of a cyber attack they had to experience, of $14.4 billion. Quite a lot of zeros behind the number. The CEO at that time, Andrew Witt, his salary, his compensation increased by 12% from 2023 to $26 million. And dividends, if you assume about $2 per share per quarter, resulted in a payout to the investors in the amount of $7 billion. This raises the question, is the healthcare system primarily to make money, or is it primarily to help patients? So these numbers, do they justify 18% increase in insurance premium? Absolutely not. Are these numbers outrageous? Is the request unethical, ruthless? I just give you the numbers and let you decide. Obviously, shooting the CEO is absolutely unacceptable. It is a crime, it is violence, it is an act of cowardness by a psychopath. We are not violent, we are discussing numbers. Well, in percent of income, we do not pay significantly more than other countries for our healthcare system in the United States. But in absolute numbers, it's just simply too expensive. And this may be because of expensive research. We have to consider that 50% of all new drugs are developed in the United States, and then other countries benefit from this research. But our healthcare system is also too complex and too bureaucratic. Just think about pharmacy benefit managers or about prior authorization. In my opinion, these are inefficient and often perhaps even dangerous steps in the process. Conservatives will now say the free market should regulate itself. However, the rules of the free market do not apply to the healthcare system because the beneficiary, the decision maker, and the payer are different. The patient has the benefit. The doctor or healthcare provider or a nurse makes the decision, and the insurance or Medicare or Medicaid pay. This is not the same like in the normal business, in the free business, especially luxury market. If I want to buy a BMW, I like it, I make the decision, I pay for it, and I enjoy it. In the healthcare system, it's different. Okay, socialists will say, we need a socialized, unique healthcare system with government control. However, in real life, in the real world, many attempts in many other countries to establish that, especially to establish a socialistic system, have failed. I'm not a socialist and I'm not a capitalist. I'm a realist. In my newest book, Real World Evidence Unveiled, I have summarized how to interpret data and facts and how to navigate through the maze of modern misinformation. It's available on Amazon as ebook, as paperback, as hardcover. I hope this short overview gave you a few hints on how to address such controversially discussed topics and how to come closer to facts and how to base your opinion on evidence in daily life and real life. Thank you for watching the Real World Evidence Perspective, which gives you truth, data, and candid content. Don't forget to like, forward, comment, subscribe, or whatever you find appropriate. Thank you very much.